I'm Nikki Highsmith-Vernick, President and CEO of the Horizon Foundation. I'd like to welcome you to our office today and to share in our celebration. We are super excited to be sharing local, regional, state, and national news with you today. To start us off this morning, I would like to introduce our first speaker, County Executive Calvin Ball. We are so fortunate to have had his leadership in public health for many, many years. He was a champion for public health on the county council and put into place many of the policies and programs that have contributed to our celebration today. And most importantly, he has led us through the biggest public health challenge of this generation. Howard County has had the lowest COVID-19 infection rates and the highest vaccination rates in Maryland. And this is due to his leadership and his tenacity. So we are coming out of COVID stronger and more resilient as a result. Thank you, Dr. Ball.
Thank you so much, Nikki. Good morning, everyone, and thank you for joining us on this beautiful day in Howard County. In Howard County, we aspire to be an excellent community for all to live, work, play, and grow. We know that it is the best place to raise a family, grow your business, or just enjoy time outdoors. We have a high quality of life, great schools, walkable neighborhoods, and a culture of healthy living. One of the biggest contributing factors to that quality of life is our culture of health. We are constantly working to improve the health of our neighbors, our family members, and our friends in Howard County. This past year, as we confronted the historic deadly pandemic, we were reminded how important our health is, how we cannot take for granted and how foundational it is to our quality of life. Our efforts have not gone unnoticed. Today, I'm honored to share that Howard County was ranked top 10 in the nation, ranking 8th in the U.S. News and World Report's 2021 Healthiest Communities. We have not only improved, previously ranking 20th in 2018, but Howard County is also the only jurisdiction in the great state of Maryland ranked in the top 10 healthiest communities. We've improved across categories in the past 3 years, as you can see on the boards next to me, but perhaps most significantly, we've seen a marked increase in our health equity from 40.5 in 2018 to 55.4 in 2021. This recognition, especially this year, means a lot to our community of partners who have advocated and invested in public health and equity for many years. Since taking office, our team has worked tirelessly to ensure all of our residents can be healthy and thriving. We continue to invest in innovative health initiatives like our mobile integrated community health team, who offer medical services to residents in their homes, and most recently have served as a linchpin on our efforts to bring the COVID-19 vaccine to as many residents as possible. We've launched innovative technology like our CARE app to reduce health disparities. We've invested historic funding in more bikeways and sidewalks, including $5.4 million in this year's budget, because we know that creating a more walkable community is foundational to healthy living. We've increased access to healthier foods, fresh local products from Howard County farms, including through our roving radish program, and we've set bold goals to reduce our carbon emissions as a government and as a community. This includes our commitment to a cleaner, more sustainable environment. Since taking office, we've planted or given away more than 50,000 trees and have enacted the strongest forest conservation law in the state. In partnership with our health department, we've activated our community to reduce the stigma of mental health challenges and encouraged our young people to know it's okay to ask to prevent teen suicide. But what is perhaps harder to measure is the collective community spirit and culture in Howard County, that feeling that we care. We care about one another and we look out for each other, especially this past year. We've seen our community put health of our family, our friends, our neighbors first. And when we asked everyone to stay home and save lives, and when we've asked our community to get vaccinated, our COVID-19 metrics and vaccination rates, as Nikki indicated, being the best in the state, prove that Howard County residents responded with a resounding yes. We know that there's always more work to be done, and frankly, we're just getting started. Our partners who are here today are working diligently and collaboratively to understand where we need to improve and pooling our resources together to address the root causes of our health disparities. I want to thank the Horizon Foundation for your hard work and dedication to drive community change so that everyone in Howard County can live a longer and better life. I want to thank our local health improvement coalition, working to improve health outcomes and reduce health disparities throughout all of Howard County. I want to thank our partners at Howard County General Hospital who have been on the front lines of this pandemic and still cared for and supported our community through our daily challenges. And I want to thank our Howard County Health Department, who have done an outstanding job in the past 16 plus months supporting our community through the pandemic and still maintaining many of our other vital health initiatives. This year, we have reinforced that when we work together, we will accomplish great things. I want to thank you to everyone who has helped make Howard County one of the nation's healthiest communities, because our work is saving lives and helping to ensure that each of those lives is lived to the fullest. Thank you.
Thank you, County Executive Calvin Ball. So next, I would like to introduce Dr. Maura Rossman. She's the best public health officer in the state of Maryland. She has led us through COVID, grounded in science and wrapped in trust. She has been a calm, strong, steady voice for public health for over 10 years in Howard County, and I'm honored to introduce her today. Dr. Rossman.
Thank you, Nikki, for those very kind words, and thank you, friends. We are all friends here, and as Dr. Ball said, friends get together and make things possible. I'm proud of the recognition Howard County has received as the 8th healthiest county in the nation from the Aetna Foundation and U.S. News and World Reports. Thank you for acknowledging Howard County as a community that makes health a priority, and thank you for supporting public health. This recognition would not be possible without the hard work of everyone at Howard County Health Department, so thank you those listening, thank you Kelly, and thank you the employees, and also the strategic partnerships with Howard County government, the leadership, and other county agencies and organizations like the Horizon Foundation. And obviously, thank you, Dr. Ball, for the commitment to support public health and Howard County Health Department over the years. Improving the public health of everyone who lives in, works in, and visits Howard County has remained the mission of the Howard County Health Department since our beginnings more than 85 years ago. Long before COVID-19 impacted our lives, ensuring health equity and access to care, improving population health before it was called population health, through education and outreach, supporting behavioral and mental health, providing essential health services to those in need, monitoring our environmental health, our food, and responding to public health emergencies were and remain departmental priorities. Howard County Health Department has a proven track record of using public health principles and strategies to address issues that undermine the health of our community, and this was certainly evident over the past 18 months. Tried and true public health evidence-based practices were deployed with tenacity and discipline. Due to our persistence, experience, and expertise, we are witnessing the positive outcomes that happen when public health has the workforce, the funding, and the community support to combat an issue. With the long game in mind, Howard County crushed COVID-19 and leads the state and country in vaccination rates. We're not done. Our goal is to vaccinate everyone eligible. So 82%, we're looking for 90% by Labor Day, so that everyone has the opportunity to be safe and well. Vaccination is the most important tool to end this pandemic. If you have already gotten your vaccine, share your experience with others who may have questions to help build confidence in this safe and life-saving vaccine. We have pop-up clinics 7 days a week. The vaccine's available at pharmacies, grocery stores, doctors' offices, and other locations, including Meriwether coming up at events. And you can call us at 410-313-6284 or visit our website if you need further assistance. While we are encouraged by this latest health ranking, we know that there will be many lasting impacts of COVID-19 affecting our residents' health, especially those vulnerable due to race, socioeconomic reasons, and those with chronic health conditions. Data has already shown the effect this crisis has had on our collective mental health. This will continue to be a point of emphasis for our behavioral health team, and staff are standing by to provide resources and referral services to anyone struggling. COVID-19 has also highlighted health disparities that exist in our community. As a county, we have worked to shift our pandemic response to ensure equitable opportunities for health care, and the lessons learned will be important to carry forward as we return our focus to the other factors affecting the health of Howard County residents. While many of our resources and attention were diverted to the COVID-19 response, now is the time to renew our commitment and focus on the many factors that create a healthier community, or a sicker one. Identifying and addressing these factors, including those not medical, like the social determinants of health, will help us target resources to where they will have the most impact in creating a healthier community. We must also commit to long-term funding of public health efforts to enable sustainable programs. Without adequate funding, it will be impossible to realize our lofty goals of the healthiest Howard County in the world. We are fortunate to live and work in a county that possesses the resources, opportunities, and resiliency to effectively respond to this pandemic and to ensure the health of our community as a whole. I'm confident with the same determination and pursuit of excellence we demonstrated over the past 18 months, efforts to improve the quality of life for all Howard County residents will be realized. Thank you, everyone.
So in my remarks, I had that our next goal was to be the healthiest in the nation, but Maura just challenged us to be the healthiest in the world. So we're raising the bar even higher. Next, I would like to introduce our world-class acute care hospital here in Howard County. We are very fortunate in Howard County to have world-class health and mental health services, and we're anchored by institutions like Howard County General Hospital, a member of Johns Hopkins Medicine. And as Maura mentioned, not only do they provide fantastic acute care, particularly during the pandemic, but they also care deeply about population health and have invested in programs that support community health and well-being. So I'm honored to introduce Dr. Elizabeth Kromm, Vice President of Population Health and Advancement at Howard County General Hospital.
Thank you. Good morning. It's back where it was, so I didn't do much in moving it. For many years, Howard County has made a healthy community a top priority. That dedication, drive, and emphasis on partnerships, those form the strong foundation that have gotten us here today. These are also the things that helped us deal effectively with the pandemic and are what made Howard County a leader in the pandemic response. We hit a milestone yesterday at the hospital. For the first time in over 480 days since the pandemic began, we have 0 COVID-19 patients in the hospital. As the county executive mentioned, it's been a long year and a half for many people, especially for our frontline healthcare workers. And I would be remiss if I didn't take the opportunity to thank you and to thank our broader community for all the support you've shown our caregivers during this time. You know, one of the categories of this ranking is access to healthcare. And as we emerge from the pandemic, it's time to reconnect with your doctor. It's time to get that annual screening or exam that you've put off. It's time to make sure your children's vaccinations are up to date. It's time to recommit to your health and well-being. As you do, know that Howard County General Hospital is here for you. We are committed to working inside and outside our 4 walls to keep you healthy. In my house, we talk a lot about feelings and emotions. My girls feel a lot of feelings. And what I shared with them this morning was that today I am feeling proud. I'm so proud of our county. I'm so proud for Dr. Ball's leadership. I'm so proud to have the Horizon Foundation in our community and for their commitment to health equity. I'm so proud to have, I'm actually getting choked up, I'm sorry. It's been a long year. I am so proud to have a public health leader, such as Dr. Rossman, running our health department. As you can tell, we feel a lot of feelings in my household. And I'm so proud of the collaboration that's come from the work with our local health improvement coalition. And I'm obviously very proud that Johns Hopkins is our community hospital. So thank you.
All right, I have lots of feelings and emotions today as well. It's nice to be with friends and be with supportive organizations in the community. So I next want to introduce Kelly Kesler. Again, you've heard this theme a lot today. We like to say we're the best in Maryland, but we do have the best local health improvement coalition in the state of Maryland. It is not only the biggest, I'll say that again, it's the biggest local health improvement coalition in the state of Maryland, but really it's elevating and tackling many of our largest public health priorities in the county, including chronic disease prevention, mental health, behavioral health, and aging. So welcome, Kelly.
Thank you so much, and thank you so much to all of our partners here. I feel very fortunate. I too have a lot of feelings in our house, Elizabeth, so don't worry about that. I feel very fortunate that we are incredibly supported with our leadership from the hospital and from the Howard County Health Department, as well as partners like the Horizon Foundation, our county government. If I come to you with ideas and suggestions, there's always a receptiveness and a willing to work together. I'd also like to take a moment and thank the 505 individuals and the 173 organizations that have formally signed up to be part of our local health improvement coalition. Over the last 18 months, they have done some pretty amazing things, including the work done by many of the folks in this room today. Along with the leadership and support from key partners, since 2012, the Howard County Local Health Improvement Coalition has been actively engaged in its mission to identify and reduce health disparities and achieve health equity in Howard County. Today, the coalition, as I said, includes over 175 organizations that are committed to ensuring that all residents have access to health-related social needs, the things that sometimes are taken for granted, needs such as food, stable housing, quality health care, and resources that decrease the risk of developing chronic conditions or resources that promote physical health and mental wellness. Our membership during the last 18 months has grown immensely, especially in relationship to the many needs that became even more apparent because of the COVID-19 pandemic. For example, our member organizations that identify themselves as addressing or being concerned about food security increased by over 83% from June 2019 to June 2021. That means our residents are listening. Our organizations are listening. They're hearing the needs of our community, and they're working together and banding together to address them. The collective energy and the strength of the organizations and individuals that are part of the Howard County Local Health Improvement Coalition is amplified to support health equity. We do this by engaging in coordinated communication and outreach to support the awareness of and access to evidence-based programs that address behavioral health, healthy aging across the lifespan, and chronic disease prevention. We're so thankful for the commitment of our individual members. We're so thankful for the commitment of our organizations. And every day I count myself incredibly thankful for the commitment of the leaders that I work with on programs like this every day. Thank you again.
So I just realized I have a few remarks too, so I'll make those real quick and then we will wrap it up. Again, we're bragging today, so that's a good thing. The Horizon Foundation is the largest independent health foundation, again, in the state of Maryland, and we are Howard County's community health foundation. I am so thrilled that we are ranked 8th in the country in the latest U.S. News and World Report's Healthiest Communities. Congratulations to County Executive Calvin Ball, the Howard County Health Department, the Local Health Improvement Coalition, Howard County General Hospital, and all of our partners in this tremendous achievement. We have so much to celebrate, especially after the past 15 months. I'm honored to live and work in a community like Howard County where excellence in public health is a priority for our elected officials, for our community organizations, and our residents. As Maura said today, they have responded in COVID. We crushed COVID, and we are here to crush, I think Los Alamos, New Mexico was first in the nation. We're here to crush Los Alamos in the next ranking. We're coming after you, just saying. But this ranking reflects such tremendous effort by our predecessors and by the leaders who you've heard from today, who created this place that we now celebrate. From a new regional partnership to improve mental health crisis services, to record-level investments in walking and biking accessibility by this county executive, and advanced care planning to look at end-of-life care for our older residents. This community has so much to be proud of. We have world-class health and mental health care. We have the lowest number of uninsured residents in the state. Again, not bragging. And we've been working on improving our health behaviors, like reducing smoking and sugary drink consumption, and increasing our physical activity. We know we're high achievers here in Howard County, and things like the social determinants of health, education, a great economy, those support our high rankings today. But we also know we have work to be done. Let's not be complacent. In particular, systemic inequities persist that prevent many of our communities of color from achieving good health and opportunity. From chronic diseases like diabetes and heart disease, to maternal and child health, to mental health, and to the impact of COVID-19, our communities of color continue to face worse outcomes than their white counterparts. So moving forward, we promise to double down on our work to make good health and well-being achievable for all. We remain committed to being a good partner in our collective work to make sure Howard County is a place where everyone can live a longer, healthier, and better life. So in closing, Los Alamos, we're coming for you. We are honored today, and in the spirit of celebration and partnership, we have flowers for each of the organizations that presented today. And with this team of talent and under the leadership of this county executive, we look forward to being first in the nation and in the world the next time they do these rankings. Thank you.